Good evening, everyone. Welcome to tonight's presentation. This is our third night of our Nurses Immunity Boost Challenge. We've been having a great time so far, learning a lot of valuable information. I'm Dr. Charmaine Blake Woode of Diabetes and Endocrine Wellness Center and the Lighter Way in Huntsville, Alabama. Along with my husband and our great presenters, our guest speakers, and our team who's working behind the scenes, we just want to say a very, very hearty and heartfelt welcome again. Thank you all for joining us. 2020 has been called the year of the nurse. And in this time, we want to just take these few nights and celebrate, honor nurses for the sacrifices that they've been called upon to make. They have been thrust on the front lines of this battle against COVID-19. And we want to support them. We want to encourage them. We want to provide information that's going to help them as they serve their patients, which many times are our friends, our family, and sometimes even ourselves. So as they serve their patients, we want to empower them to take care of themselves as well as serving their patients. And so with this in mind, we have created this challenge to provide information for the nurses to help boost their immune system. We've got a broad scope of information that we've been presenting and will continue to present to you this week. Starting on Wednesday evening with a nurse on the front lines herself, just sharing her experiences and her staff experience with COVID-19. Last night, Dr. Ryan Simon taught us about the way COVID-19 is transmitted, and he also shared some ways that we can prevent getting or contracting COVID-19. He taught us to mask up, social distance, wash our hands, and get the vaccine whenever we can. So if you committed to doing at least one of those things last night, go ahead and put it in the chat. Even if you weren't here last night, just choose one of the four things I mentioned: masking, distancing, washing hands, and getting vaccinated. So even though you weren't here last night, you can still make a commitment to do one of those things to keep yourself as safe as possible from COVID-19. But I do want to recognize our nurses this evening. If you are a nurse in the viewing audience, please put in the comments, just put nurse or I'm a nurse. Go ahead and put that in the comments so we can recognize who you are, and so we can give you just that special honor, that recognition. But this challenge and this information, even though we're celebrating and targeting nurses, the information is not just for nurses. The information is for everyone. So I want you to go ahead and tag your friends, everyone you know, tag your family members. Particularly, we do want you to tag those nurses in your life and invite them to join this live presentation this evening. We want them in our viewing audience as well. But of course, you guys know each night I share with you some of our expectations or some of our requests, and I'm going to do so tonight as well. First thing we want you to do is to register for the challenge. Go ahead and register. You register at teamdestinyevents.com. That's the website. So go ahead and register for the challenge. We want you to invite guests. We want you to engage with us during the presentation. We want it, even though it's a video broadcast, we want it to be as interactive as possible. Let's get engaged. That way, everyone will get more out of the presentation. So go ahead and register. share the video, and get ready to comment, get ready to like. We also want you to use hashtags when you're sharing. So we've got 3 hashtags dedicated to this event. The first one is Team Destiny Events. Team Destiny Events. The second one is Year of the Nurse. And the third one is Immunity Boost. If you use those hashtags, then we can track how widely this information is shared. So help us with that by using the hashtags. If you don't mind, go ahead now and share using the hashtags. So as usual, we've got some more giveaways tonight. We've had some amazing giveaways already. Rhonda B took home that $50 spa and wellness gift card our first night. And we'll announce the winners from last night a little bit later on in the program this evening. Remember, you've got to register, you've got to share, and you've got to use the hashtags. So if you're ready to get started, now that we've gotten all of that housekeeping out of the way, if you're ready to get started, put "let's go" in the comments. Let's go. Let's go. Let's hear what our next speaker has to share with us this evening. So put "let's go" in the comments. So I'm pleased and I'm honored to have speaking to us tonight, Dr. Shahan Stutes. Dr. Stutes will speak on the body's immune response to COVID-19. I can't wait to hear what he's going to share with us. I'm sure it's going to be impactful. But a little bit about Dr. Stutes. So Dr. Stutes received his medical degree from Texas A&M University Health Science Center in College Station, Texas. He completed an internal medicine and pediatrics residency at Wright State University in Dayton, Ohio. He then went on to complete his fellowship at The Ohio State University in Columbus, Ohio, and his fellowship is in allergy and immunology. While he was completing that fellowship, he served as the chief fellow. So that tells you a little bit about the caliber of the presenter tonight. Currently, he is an assistant clinical professor at the University of Oklahoma Health Sciences Center. He's board certified in internal medicine, in pediatrics, and in allergy and immunology. He's married to a fellow physician, and he enjoys spending his time cycling, sailing, and spending time with his wife and his 6 children. Thank
you for that lovely introduction.
That's a full quiver.
With some luck, none of them will run into this room during the lecture. So we'll see.
All right. So you guys, please, I'm introducing you to Dr. Shahan Stutes. Let's hear what he has to share with us this evening.
Well, thank you for the invitation to participate in this series. It's a real honor to try to contribute in some small way to what the nurses are doing right now, and pretty fun to collaborate with Dr. Woode after all these years. So appreciate the invitation. My challenge today is to cover the immune response as it pertains to COVID-19 in 15 minutes. So I'm going to do the best we can. So we'll get rolling. My objectives are to help you understand the basic immune response and understand the immunopathology of COVID-19 infection. And my goal is that you'll be able to apply this knowledge to better understand the new developments that are reported quite commonly in the news. I think it's exciting that in lay literature now we'll see talk about T cells and B cells and antibodies, and I think it's very important to be up to speed on all these terms. And then lastly, I'll try to give you some tips to help you strengthen your own immune system. So our immune system, as we know, is designed to keep all the foreign intruders out, whether it be a parasite or fungus or protozoa, or in this case, a virus. And there's 2 main arms to your immune system. We have the innate immune system, which is the part of the immune system that comes already pre-programmed at birth to respond to different invaders. And then we have the adapted immune system, which over time learns from past infections and exposures or vaccinations to better protect us from infection. So let's dive into the innate immunity. So we have cells in our body that have receptors on them that are designed to recognize patterns commonly found in nature and associated with bacteria or viruses that infect human beings. And when these patterns are recognized, these cells release chemicals into the blood called cytokines or interferons, which cause a localized inflammatory response and wake up surrounding cells, giving attention that there's an infection. So it signals neighboring cells to put up barriers to protect themselves from infection. It signals infected cells to die, and then it causes recruitment of other cells to the area. Now, all this leads to localized inflammation, which if you've ever had like a paronychia or a little infection in your nail bed, that's similar to what's going on. We've got blood rushing to the area. We've got inflammatory cells going there, priming your body to respond to whatever foreign invader is present. Now, in coronavirus infection, this process is happening in your lungs. And just like our thumb, which can become inflamed and full of fluid and irritated, the same thing can happen in our lung in response to our own immune response to infection. So we have step one, the coronavirus infecting lung epithelial cells. And then our immune cells recognize that something is going on, and our macrophages secrete cytokines into the area, which then attract more immune cells. And those immune cells produce more inflammatory cytokines, which lead to inflammation, the production of additional inflammatory cytokines, and the recruitment of more inflammatory cells. What makes coronavirus different is that in some infections, it can lead to dysregulation of this innate immune response, where the more cells that come in, they produce more cytokines, which leads to more inflammation. And that process causes this to get out of control. And this is what we call cytokine storm. So on the left here, we have a normal chest x-ray, and on the right, we have a chest x-ray of acute respiratory distress syndrome. And all the white we see obscuring the lung tissue is fluid that's come into the area due to this cytokine storm and inflammatory response. Now, you may have heard about steroids possibly being effective in patients with coronavirus infection, and they were thought of being used because steroids can calm inflammation and the inflammatory response. So in this one study, they looked at dexamethasone, and they looked at it in patients who were on mechanical ventilation, patients who were receiving oxygen, or patients who were infected but not yet requiring any ventilator support. And what they found is that it did indeed protect them from death over the next 4 weeks. And so it seems like calming down this local immune response is effective in treating patients with coronavirus infection. Now, it did not show a benefit in patients who were not yet on oxygen, but this study only looked at death. It didn't look at progression to hospitalization or progression from being hospitalized to needing oxygen. It only looked at mortality. So some further questions need to be answered, and it may be effective for those patients as well. So we've talked about the innate immune system, and we reviewed that its main purpose is to send out signals of alarm that infection is taking place, recruitment of inflammatory cells, and slowing the infectious process to buy the body time to ramp up its more sophisticated adaptive immune system. And so that's what we'll discuss now. So the adaptive immune system starts with a cell called a dendritic cell. These are cells that are circulating within tissues throughout the body, and they're constantly surveying different proteins in this area. And when they encounter a protein that seems foreign, they take it up and transport it through the lymphatic system to your lymph nodes. In your lymph nodes, it presents these foreign materials to different T and B cells. And over time, it finds one that at random happens to attach to this foreign body. So then it recruits that cell to then divide and turn into multiple cells. And when it divides, that lymph node can swell. So if you've ever had a strep throat and during your infection, you notice you had swollen lymph nodes in your neck, that's the process that's going on. So then these recruited T and B cells then go through the lymphatics back into the bloodstream and are recruited to the site of infection. So the first cell we'll talk about is the cytotoxic T cell. The main purpose of this T cell is to recognize viral protein, which is presented on the surface of infected cells. And when it encounters an infected cell, it then sends a signal to kill the cell. So it's the ninja assassin of the immune system. The second cell we'll talk about is the B cell, and the main purpose of your B cells is to produce antibodies. One of the types of antibodies it produces is neutralizing antibodies. These antibodies attach to free circulating virus, and in attaching to it, it prevents it from entering cells and causing further infection. Another type of antibody is non-neutralizing antibody. These antibodies are designed not to attach to free circulating virus, but to attach to viral particles which are presented on the surface of infected cells. And so when these find their target and attach, they then recruit the natural killer cell, which then recognizes that the antibody has attached and then sends a signal for the cell to actually kill itself, cellular suicide. So they're like the Godfather kiss of death cell. Some of these B cells, if the immune response is vigorous and was stimulated strong enough, will develop into plasma cells, which are basically long-lasting antibody-producing cells. And they nestle in different lymphatic tissues, and over our lifetime produce small amounts of antibody, which stay present to protect us from infection. So there's two phases to this adaptive immune response. We have the primary immune response, which is a little slower to get started and not quite as robust, but typically takes care of the infection. And then over time, antibody levels wane, which is normal. And then upon second exposure to the pathogen, the response is much more vigorous and quick. And so it's a lot more effective in preventing any illness. This is also why many of our vaccines are given in series. So you'll have initial vaccination, and then 2 months later another, and then 2 months later another, depending upon the vaccine, to make sure that we have a vigorous immune response. So this is what we mean when we talk about immune individuals. So they have already programmed their immune system to respond to the specific pathogen. So upon re-exposure, they're much less likely to develop symptoms, and they're much more likely to clear the virus before it results in infection. So if we look more closely at SARS-CoV antibodies specifically, we see that there is a small rate of antibodies being present in negative control patients, and this may be due to other similar viruses that circulate in the community. But if we look at asymptomatic, mildly symptomatic, and severely symptomatic patients, they almost uniformly all generate antibodies against SARS-CoV-2. What is interesting is that patients with more mild infection tend to have lower antibody titers than those with more severe infections. So it's probably more likely that if a patient had a more severe infection, they're more likely to have higher antibody levels over time. Now, about 90% of patients will have waning of their antibody titers following infection. They typically first show up around 3 weeks after infection, and then over the first 3 months, there tends to be a fair amount of waning of the antibodies. So what about long-term immunity in COVID-19? So far, reinfection rates remain very low. As of October 2020, American Journal of Medicine did a review, and they only found 5 case reports of reinfection. Certainly, there's been more cases than of reinfection, but the fact that there's so few cases reported in the literature tells us the rate must be very low. One of these cases was in the United States. 4 were outside of this country. 2 infections were more severe than the initial cases. 3 of these cases were as mild or milder than the initial infection. The case in the United States was a 25-year-old man who had no other health problems and no immune deficiency. And he contracted the virus. It was a mild infection and recovered. 6 months later, he developed symptoms consistent with coronavirus infection and tested positive again. Researchers dove into the specific strain of each virus that infected him each time, and the strain was significantly different from each other. So they believe that he contracted a different strain of the virus, and that's why he was reinfected. Overall, it seems that reinfection rates are likely going to remain very low, but because more data is needed, it's recommended that you continue social distancing after infection until more is understood about reinfection. But it's very likely that your immune system is going to have your back. So, vaccination, yes, finally vaccination is here. Some of you have probably already received it. I am anxiously awaiting my turn to roll up my sleeve and stick out my arm. But clearly, vaccination is going to be the safest way as a community to achieve herd immunity. This chart just illustrates that if you have a situation where you have no immunization and no social distancing, you end up with widespread infection and a mix of deceased patients, patients with chronic morbidity associated with their disease, and patients who survive and have immunity. With social distancing, you can slow the spread, but over time, you end up in a similar situation. Immunization allows us to prevent widespread disease amongst individuals and leads to lower morbidity and mortality over time. So, how can we make our immune system as healthy as possible to prepare us to fight off coronavirus infection or any other infection? So, I picked this picture of Arnold at random, but then I noticed it looked just like an antibody, so I thought it was appropriate, so I included it there. So, exercise. Research on exercise and your immune system function is still in its infancy, but there has been a fair amount of data presented recently that's exciting and shows that you can improve your immune system with a healthy lifestyle. Moderate exercise has been shown to improve the immunosurveillance of your innate immune system, making it more likely to encounter and attack viruses or bacteria sooner. And also to find cancer cells, which your immune system can deal with as well sooner. It has been shown to reduce your rate of acute respiratory illness in general. It reduces your systemic inflammation, which, as we learn about cytokine storm, is going to be very important in something like coronavirus infection. It reduces your risk of other chronic diseases, which in turn these other chronic diseases could affect your immune response. So by preventing those diseases, you keep your immune system healthy. And then there's a natural process called immunosenescence, where your body's immune system gets more sluggish as we age. And that puts you at risk for infection as we get older and complications from infections too. And it's been shown that regular exercise as we age can slow the effects and in some cases completely mitigate this immunosenescence. Now, one caveat I do want to mention, it's also been shown that overreaching with exercise and super intense or prolonged stints of exercise can actually transiently weaken and stun your immune system, making you more likely to have infection. It's clearly been shown that after marathons, participants who participated in the longer events were more likely to have upper respiratory tract infection after their event. And then another thing we can do is maintain a healthy weight. Obesity is associated with increased inflammatory cytokines. We all know about cytokines now and how important they are in inflammation, and we can reduce that. Being obese reduces your cytotoxic T cell function, so your assassin cells don't work as well, and your virus the virus has a chance to reproduce before you can kill those infected cells. And then it also reduces the function of your natural killer cell function. Studies looking at coronavirus specifically have shown that being overweight can increase your risk of admission to the hospital after contracting COVID-19, up to 4-fold increase in the most obese patients. Other data has shown that your risk of dying from coronavirus is markedly increased with obesity, even if you control for other comorbidities and age. Lastly, I want to mention you might want to talk to your doctor about vitamin D deficiency. There's been a strong association of vitamin D deficiency and increased risk of death amongst hospital-admitted patients with coronavirus. Now, I want to be clear that this is just an association and doesn't show causality. But there's some other data we can dive into that maybe would suggest that this association is exciting and we're onto something. There was a well-done randomized trial of vitamin D supplementation in school-age children. And the aim of the study was to see if supplementing these children with vitamin D could prevent the incidence of influenza A infection. And in fact, they found an absolute risk reduction of almost 8% in patients that were supplemented versus those that weren't. That means you only had to treat 13 children with vitamin D to prevent one from an infection. Now, if you're not familiar with the term number needed to treat, that may not seem that impressive, but in medicine, a number needed to treat of 13 is actually quite strong. British Medical Journal did a meta-analysis where they combined data from 25 different studies looking to show the same thing that this influenza virus study was trying to show. And they demonstrated that when you combine the data from all these studies, you did indeed show that there was a reduction in the rate of acute respiratory tract infections in patients who were supplemented with vitamin D, particularly during the winter season. So these aren't referring specifically to coronavirus, but it may suggest that this association we've seen of added morbidity and mortality in patients with vitamin D deficiency in the setting of coronavirus infection may in fact be causal. So we made it. I'll open it up for questions.
That was wonderful, Dr. Stutes. Thank you so much. Lots of great information. Took some notes. So I've got a question, actually. We typically think of patients who are on chronic steroids as being immunocompromised. And right. I know you mentioned studies in terms of steroids being part of the treatment. And there's a little bit of maybe a contradiction where we typically think of them as being immunocompromised, sure. But then, you know, steroids are used for treatment. So is being on steroids protective against contracting COVID-19, or how does that work?
That is a great question. And you're right, it does need to be distinguished from acute treatment. So being on it chronically would likely increase your risk of complications from coronavirus infection. And in the study, RECOVER study, patients were initiated on the steroids later in the infection, after the cytokine storm was already occurring. It's been theorized that if steroids are given too early, you may mitigate your body's response against the virus and allow more widespread viremia, which could then worsen the infection. So the thought is now is that it's better, if steroids are used, it should be later in the infection. And I would agree with you that chronic steroids would likely be a risk factor for coronavirus infection or complications.
Okay. All right. So question about the vitamin D that you mentioned, that there's a correlation between vitamin D deficiency and more severe illness. Am I remembering that correctly?
And more mortality.
Mortality. Okay. What level? So if I go and get my vitamin D level checked, what level should I be aiming for? Or if I choose to, even if I'm not low and I choose to just supplement because, well, Dr. Stute said, be sure my vitamin D level is good, but I don't have time to go get it checked.
That's true. You know, different countries use different indices and different values. I'm not really sure exactly what level you'd want to achieve, but I have seen studies that shown incremental benefit at different levels, even increasing incremental benefit above the point that's thought of being normal. You might be more familiar than me with the normal levels.
Right. So, you know, so 30, usually 30 or above is what, you know, what the lab says as being adequate levels of vitamin D. Do you have any suggestions on the dosage? You know, is 800 international units, is that good, or do I need to take 2,000 IUs a day? Did the study specifically speak to maybe the doses that they would recommend? Or
well, so in that study of children, they were treated with 1,200 IUs in that study. I think there's different levels you want to take, whether you're deficient or just supplementing or not. I believe just standard supplementation is 2,000 IU.
Okay. All right. Okay. Well, good. So I'm not seeing any other questions.
I saw a question from the running nurse that looked interesting.
Okay, all right. I didn't see that one.
She says she's a runner and she noticed that she gets respiratory infections after long distance events. It doesn't last long, but she had been wondering what it was and what she could do about it. I have seen a trial that tried protein and carbohydrates and electrolytes to see if they could affect that risk. And it seems like making sure that you have adequate carbohydrates before, during, and immediately following your event was associated with lower rates of respiratory tract infections in, ultra marathoners and people doing long distance events. So that may be something they could do. And then it would seem that making sure that if you happen to detrain, to not push yourself beyond what you're able to do, and maybe stick with a more modest training schedule where you increase your distance more incrementally, as opposed to just jumping in to what you used to do after a break.
Okay, all right. Well, I thought that was an important point about the effects of exercise on, boosting the immune system, and also just warding off some of those chronic illnesses that do put people at increased risk for more severe infection. I think it was a great point that you brought out, that moderate exercise, so not so much the high intensity,
Yeah.
but the moderate exercise, because the high intensity actually causes more stress. So I think that's an important takeaway.
Yeah, I think in the study I was referring to, they were looking at 60 minutes of walking 3 times a week, or 30 minutes of moderate intensity exercise 3 times a week. And then in addition to that, they've also shown that resistance training can cause a robust improvement in your T cell response, which may protect you from infection, or maybe even protect you from cancer.
Okay. Well, good. So you mentioned the vaccine, that you're eager.
Yes.
To get it, but in terms of how long does the immunity last, and when do you need a booster? Do you have any information on that you can share?
Nothing beyond just the fact that so far these vaccines require 2 shots, either 3 or 4 weeks apart. And I do know that some of my colleagues have talked about, 6 weeks after their vaccination, maybe checking a SARS-CoV antibody titer just to see if they developed an immune response. But I think due to the length of the trials, only time will tell.
Okay. All right. So that's still information that we're, I guess, trying to gather. Okay. Well, good. Okay. So, question about the antibody titers.
Mm-hmm.
So, what I understood you to say, or from that study you showed, was that the antibody titers correlate with the severity of infection.
Right.
Now, is that because they received a larger, I guess maybe they were inoculated with a larger dose of the virus per se, or that's just how the body responded to the virus? What accounts for the difference in the differences in the levels of antibody titers?
I think it's likely because their viremia was more dramatic and they had to develop a more robust immune response. However, some researchers look at that and interpret it a different way. They wonder if, since a lot of the pathology from the disease results from our own immune response against it, that perhaps the antibody titers being elevated may be part of the pathology. It's not clear which one is correct at this point.
Okay. All right. Well, Dr. Stutes, great information. You took me back to my immunology courses in medical school, which most days I would rather forget. But it was very informative. So thank you so much for taking the time to spend with us, share with us this information. And hopefully in the future, there's still more that we have to learn about this disease. Hopefully in the future, we can have you back and you can share some more. Give our regards to Josephine and the kids, and you all stay well. And maybe you can maybe share on Facebook or some other platform when you do get your vaccine. That might be interesting.
Sounds like fun. I can't wait. And I appreciate the very engaging audience. I'm excited. We got some good questions. That was fun. Thank you.
All right. Thank you. Thank you so much. All right. Well, that was great information. Let's talk about what you can do to put some of this into action. So he mentioned getting regular exercise, also mentioned maintaining a healthy weight, and he mentioned the correlation between vitamin D and the severity of the illness, or even vitamin D and mortality, death. So I want our listening audience to just choose one. Not going to ask you to do three things, but just choose one thing that you want to commit to as a means of boosting your immune system. So are you going to get your vitamin D level checked to make sure it's adequate? And if you don't have a vitamin D level within normal range, we want you to commit to taking vitamin D supplementation so you can get your vitamin D levels up. He mentioned that during the winter time, it's hard to get vitamin D from the sunlight. Also, if you are dark skin like I am, then you don't get as much vitamin D despite spending a lot of time outside in the sunshine. So a lot of people do have to depend on vitamin D supplementation. So maybe you're going to target your vitamin D levels. Maybe you're going to target your exercise. And maybe you're going to target your weight. In order to get to a healthy weight, if you're not already there, you may need to look at what you're feeding your body. So I want you to pick one. So tell me which one you're going to do. And let me see those in the comments. So vitamin D, weight, or exercise. Want to see those in the comments. Let us know what you plan to implement as a way of keeping your immune system healthy, or maybe getting it to a healthy level. Okay. All right. So I want to see those comments. Want to see those comments. All right. So we've got winners from our challenge from last night. We've got 2 winners. So those winners are going to be Althea M and Monica W. So someone is going to win the $50 gift card, and another one is going to win a bottle of the Oxygen Immune Boost, which, by the way, has vitamin D to help boost your immune system. Remember, though, in order to win these prizes, or to be eligible to win the prizes, you do need to register. So register, share, comment, like, just engage with us during the presentations. So we've had another awesome night. I think Dr. Stutz did a great job with sharing some very technical information, and hopefully you'll walk away with a better understanding of how your immune system works and how your immune system responds to the COVID-19 virus. And you've walked away with some strategies to boost your own immune system, particularly for our nurses who are placed in close contact with patients who are infected with COVID-19. So we want to make sure that you are doing everything you can to take care of yourself and to stay safe. So coming up tomorrow evening, we have Dr. Milton Brown, who will be sharing with us some information about developing therapeutics against COVID-19. This is some of the work that he's doing in his own laboratory. He'll also touch on the vaccine, because we've been touching on the vaccine the last couple of nights, and share with us his thoughts about the vaccine. So we want to see you back tomorrow evening to hear Dr. Brown's presentation. I think that's going to be a very exciting presentation, as he'll talk about some of the things that are on the horizon. There are certain individuals who may not be able to take the vaccine either because they've got allergies or they're in special categories. For example, there's discussion about whether or not pregnant ladies should take the vaccine, and the vaccine isn't approved for children currently. So we need some other ways, some other strategies to deal with this pandemic. So that's coming up tomorrow night, and Dr. Milton Brown is going to be our speaker. So I do want you to remember, of course, to share this information with the nurses that you love in your life. Share it with your family members, share it with your friends, because it's important for everyone to get this information, even though we're taking the time and making special effort to honor and celebrate our nurses. So we've got tomorrow evening coming up. That's going to be our 4th night. And on Sunday night, the 5th night, we've got a panel of nurses who are going to collectively share their experiences with COVID-19, also share some of the strategies they're using to protect themselves, to keep themselves safe. So we look forward to seeing you again tomorrow night. Same time, right here on Facebook and YouTube. We'll be live again at 8 p.m. Eastern Time, 7 p.m. Central. So we look forward to seeing you. Until then, take good care and have a good evening.